ये सिक्स पैक बनाते हैं ना, रेक्टस, तो ये रेक्टस मसल के अंदर आता है डेस्मॉइड ट्यूमर. Now this desmoid tumor has one important quality, which is it has a high chance of recurrence.
अच्छा.
Like we had discussed cystosarcoma phyloid in the breast, so it has a high chance of recurrence.
सर्जरी सिंप्लीफाइड, शस्त्र कला सरल शब्दों में.
हेलो एवरीवन, वेलकम बैक टू आवर चैनल सर्जरी सिंप्लीफाइड, शस्त्र कला सरल शब्दों में. मेरे साथ हैं डॉक्टर निखिल.
नमस्ते.
सो हमने काफ़ी कंडीशंस के बारे में डिस्कस किया. अक्यूट एब्डोमिनल पेन, क्रॉनिक एब्डोमिनल पेन, और क्या इम्पोर्टेंट एस्पेक्ट्स हैं.
इन दिस सीरीज ऑफ जनरल सर्जरी which we are covering, there are two topics, or rather one topic which is remaining, which is lumps and bumps.
Lumps and bumps.
Lumps and bumps. यानी कि जो गांठ रहती है. So in this series we will cover lumps which appear in different parts of the body, and then one which is lump in the neck.
अच्छा.
Now in the central part of the neck is the thyroid, and sometimes you get lumps in this part of the neck. So that will be other episode, next episode. In this episode we will discuss all other lumps which appear in different parts of the body.
Okay.
Because again this is a very common condition for which people consult surgeons, and they have got a lot of misconceptions about these. Okay, so let's start with skin and subcutaneous tissue. So most of these lumps or bumps, they come in different parts of the body, such as on the forearms, on the back of the neck, on the scalp, on the feet, on the groin, on the thighs, etc. Broadly speaking, these lumps are basically 4 or 5 types. The first is what we call as a lipoma. What is lipoma means? It is a tumor of fat cells. Tumor of fat cells. So this, wherever there are fat cells, it can come. Since fat cells are all over the body except in the scalp, you'll get lipomas anywhere, and they are a part of what we call as differential diagnosis. That means for any condition we have got 2 or 3 causes which we think of. So lipoma becomes a differential diagnosis in any lump anywhere in the body, especially superficial parts. Okay, that is the first, lipoma. The second is what is called as sebaceous cyst. Now sebum is what is secreted by all the glands which are there all over the skin from which the hair grow. Okay, so sebum keeps the skin lubricated and soft. So you have sebaceous glands. These glands secrete both sebum and perspiration also, and they are concentrated in some areas, especially hairy areas like the scalp, like the axilla and the arms and the limbs. Okay, now if the gland opening gets blocked, right, then it will start becoming into a cyst. Okay, so while the lipoma is actually a tumor of fat cells, it is known as a tumor, benign tumor, not cancerous, benign tumor. Sebaceous cyst is called as a retention cyst. Retention cyst means that because the blockage of the gland, every gland has got a small opening through which the sebum will come out. If that gets blocked, then the sebum will get retained and that will form a cyst. Now you can get very big sebaceous cysts also. Okay, so this is the second kind of cyst. The third kind of cyst is called as a dermoid cyst. Dermoid cyst. Now when the body is developing, there are lines of fusion, like the midline. The body fuses, then over here there is a line which goes like this, then there is a line in the midline of the scalp, right? Midline of the back. So at these lines, when tissues fuse, sometimes what happens is that the skin cells, the cells of the skin, or what we had discussed, ectoderm. If you remember, we said in one episode there is ectoderm, endoderm and mesoderm. So ectoderm is the skin, hair, teeth, etc. Mesoderm is muscles, and endoderm is the glands and the intestines and things like that. So by mistake, the ectodermal cells get caught up inside the mesoderm or deeper layers of the body. And when it fuses, these cells grow and they form a cyst. So these generally occur in areas of the lines of fusion. So you will get a external angular dermoid over here, or you get a dermoid cyst in front of the ear, or you will get it in the middle of the scalp, or you will get it at the side of the scalp here. You will not get it all over the body. You will get it at specific sites, which are the sites where the body's lines are fused, or these three layers are fused. You will get it in the midline of the neck, or you may get it in the midline on the back. Sometimes they may be deep seated, as I told you, ovarian dermoid cyst. Remember I said it is a teratoma, so it can be in the ovary, or it can be pressing between the spinal cord and the bone of the spinal, the spine and the spinal cord. You can get a dermoid cyst there. So if it is deeper, it will need a major surgery to remove it, but they are benign. Okay, so that is the third one. Then we have what is called as a hamartoma, Hamartoma. So we had lipoma, sebaceous cyst, dermoid cyst, hamartoma. What is hamartoma is? It is a tumor of some tissue which is of that area. For example, if there is a blood vessel and the blood vessel grows and becomes a tumor, that is known as a hamartoma. If there is a muscle, the muscle tissue grows and forms a tumor, that will become a hamartoma. So all tumors that do not fit in sebaceous cyst, lipoma and dermoid cyst generally are hamartomas. The commonest type of hamartoma is a hemangioma, that is blood vessel mass. So sometimes you see people getting a birthmark, they say birthmark, reddish on the forehead or on the face there is a reddish blotch. That is one type of hemangioma. But you also get a hemangioma coming in the form of a swelling. But the important thing is to recognize that that is a hemangioma, because if you try to operate it without proper equipment, it can bleed ferociously. Generally, hemangiomas appear mainly in the head, face, neck area. They can also appear inside organs, like in the liver. You get one of the common organs in which hemangiomas are seen are in the liver. Okay, so that is hemangioma. Then you have got tumors of muscle and you have got tumors of the nerves. So from a nerve you will get a tumor which is known as a neuroma, because it is arising from the nerve itself. So when you remove the tumor, you may damage the nerve. It's a neuroma. And in the muscle. Okay, so you can get tumors in the muscle. So they are a little deeper and they are deep seated, and they can cause problems by way of pressing on the nerve and causing pain, or involved in movement. Suppose they are near a joint, they can hamper the movement of the muscle because it is inside the muscle. Okay, one common form of this tumor is called as Dermoid tumor, which is generally seen on the anterior abdominal wall in this muscle. ये सिक्स पैक बनाते हैं ना, रेक्टस, तो ये रेक्टस मसल के अंदर आता है डेस्मॉइड ट्यूमर. Now this desmoid tumor has one important quality, which is it has a high chance of recurrence. Like we had discussed cystosarcoma phyloid in the breast, so it has a high chance of recurrence. So what happens is that most of these tumors start as small and then they become big. Most of the people neglect them initially, but later on they come and show it to us. So clinically we can see and try to find out what they are. For example, in case of lipoma, it is soft and it slips easily, moves, okay, slips, and skin over it is normal. It may be in the subcute tissue that is just under the skin, or it could have deeper ramifications. Some lipomas go inside the muscle also. So anywhere in any layer between the muscle and the skin, the lipoma can be. It can be in 2 layers also. Doing an ultrasound will immediately tell you which is a lipoma or not. If still there is a doubt, you can put a needle and do a fine needle aspiration cytology, FNAC, and then plan the surgery if the patient is worried about it, or if you find that the lipoma is increasing in size. Whenever any tumor increases in size, it needs to be operated. So a lipoma can be diagnosed with the help of ultrasound, confirmed with the help of FNAC, and the treatment is excision of the lipoma if the lipoma is causing a problem to the patient by way of some symptom like pressure on the nerve or something, or it is increasing in size, or he or she wants it to be removed for cosmetic reasons. That is lipoma. Sebaceous cyst. In sebaceous cyst, what happens is the punctum of the duct opening is a black spot and it remains there. So when you see a swelling in a hairy area with a spot there, which is a black spot, you know that this is a sebaceous cyst. Sebaceous cysts, because they are from the skin cells, the sebum glands in the skin, are not deep. They're never deep, they're superficial, so they grow up. Alright? But one thing about sebaceous cysts, they are prone to infection. So once they get infected, then they cause a very dirty smell, and then most times you cannot, you should try to treat it with antibiotics and then remove. If you remove the sebaceous cyst when it is infected, it is very likely to recur. It may come back because it's difficult to remove the entire cyst because it's all mushy and it is like pus. So it's difficult to identify the cyst wall. If you leave the cyst wall, it will grow. So it's better to treat with antibiotics, let the infection settle and then go and remove it. Ideally, if you have a sebaceous cyst, you should get it operated because it is going to get infected at some stage or the other, because the sebum is a good medium for bacteria to grow, especially if you are a diabetic. So it is prone to get infected. So it's best to get it removed. Same thing with the dermoid cyst. Again, the dermoid cyst can be at different levels because it is arising from lines of fusion. Especially on the skull, you need to take an X-ray to see if there is a dent in the skull where the dermoid cyst is. So sometimes, very rarely, a dermoid cyst can be dumbbell shaped. It can be partly inside and partly outside. Then it will need a major surgery. Otherwise, if it is superficial, it can be removed. Again, over there, if you need to, you can do ultrasound and FNAC, confirm, and then excise it. Next comes the hemangioma. Now, a hemangioma, you should never do FNAC. Why? Because if you put a needle, it will bleed. Now, so what do you do? How do you think that this is a hemangioma? First of all, it will be bluish in color, like a dilated vein, like that varicose veins we saw in photographs. It will be bluish. Second, it will pulsate because it is consisting of a bunch of vessels, so it's very likely to pulsate or show some pulsations. Third, it may have a bruit. If you put a your stethoscope on that, you can see some blood going, like that sound may come. Alright? So, if you have doubt, do not do FNAC, but take proper care to have proper cautery and proper instruments when you do it. And because I have removed hemangioma from below the eye or from the eyebrow, so it is areas which are cosmetically relevant to people who come for these surgeries. You need to be careful that you use proper technique to remove it so that it doesn't bleed and you remove the whole thing. The one which I removed from the eye was operated 4 or 5 times in different places and it had recurred. Because they did not take care, when they opened it thinking that it is some ordinary swelling, it started bleeding torrentially. So they just did something and it recurred. So I took proper care, it was going deep and I could remove it fully. So when you are tackling a hemangioma, especially if there is any soft swelling on the area of the face, which is the common area, you have to be very careful that it is not an hemangioma. If it is a hemangioma, you have to have proper instruments, cautery, bipolar cautery, everything should be there to take care of the bleeding so that you can remove it completely.
Okay.
Then comes the neuroma. Neuromas are generally in relation to a nerve. Okay. When you tap on that, the person will get a shock.
Okay.
Okay. As far as possible, the neuroma can be left alone. You don't have to do it because in removing a neuroma, there is likelihood of damaging the nerve. Okay. So what you need to do is you have to take consent, properly informed consent that I am operating on the nerve. If I cannot remove the entire tumor, I may have to sacrifice some part of the nerve and your nerve may get affected. So on a case-to-case basis, you need to evaluate whether removing the tumor is worth it or not worth it. Of course, if the tumor is increasing in size, causing a lot of pain because of pressure, etc., then you have to go and remove it. But because it is there to remove it, it's not necessary. You can wait. There also, you can prove it by doing an FNAC that it is a neuroma. You can reassure the patient that this is a benign swelling which is arising from the nerve. If we try to remove it, it can damage some portion of the nerve. Okay, so that is the neuroma. And the last was the desmoid tumor. Now the desmoid tumor is considered as a local recurring mildly malignant type of tumor because if you do not remove it with a wide excision, you have to remove the tumor and you may have to remove surrounding muscle. And you may have to reconstruct that by putting a mesh or some kind of thing there because it will leave a big gap. If you don't do that and you're thinking in terms of desmoid tumor, especially if the FNAC shows that is a desmoid tumor or it is a tumor which has been operated before by somebody and now it has recurred and now you are the person doing the operation second time, then you have to take care to see that you do a wide excision. That means at least about half a centimeter on all the sides plus on the depth. You must remove all the tissue and then reconstruct it. Because it's in the anterior abdominal wall, it may weaken the muscles and you may get incisional hernia. So anticipating that, you should put a mesh, what you would otherwise do for a hernia repair. So that becomes a slightly bigger operation. So if you leave the desmoid tumor, all the other operations, most of them can be done under local anesthesia. You can give local there and you can do the operation. However, if there is a larger tumor like a large lipoma, sometimes lipomas become big. I've removed these big lipomas from the groin or from the back. There probably it's better to give anesthesia.
Okay.
So if it's in the lower part, you can give a spinal anesthesia and then turn the patient and do it. If it's in the upper part of the body, but if it is big, like it can be big lump here on the shoulder or the forearm, then it's better to give general anesthesia and do it. Or if you can do it in regional block, block the anesthesia, but with the help of an anesthetist. Because local we give ourselves. We don't need an anesthetist. Okay? So these are the common lumps and bumps. Because they are visible to the patient, they cause of anxiety in the patients.
Right.
And they come to us. Some of them go to skin doctors. I don't know why. But then finally they somehow land up with us because skin doctors don't do the surgical removal of these lumps and bumps. So they then do come and end up with us and then we reassure them. But if you say commonest, there are three: lipoma, dermoid and sebaceous. They are very common. Desmoid tumor, hemangioma and neuroma are less common but not infrequent. Means you do see regularly, maybe one case in one case in maybe 1.5, 2 months you always see these kind of tumors. Desmoid is less frequent. You may see once in a year or once in 2 years, like that. But neuroma and hemangioma are pretty okay. Most people would have seen several of them in their career. And this dermoid, lipoma and this lipoma is the commonest. Lipoma is the commonest. Lipomas also can recur because lipomas have this habit of, expanding like fingers into different areas. So you have to remove all those fingers. And sometimes they are in different levels. Part of it is up, part of it is down. So you need to see that you remove the whole thing. If you leave some of it back, it can recur again. So lipomas, there is a chance of recurrence. As any of this dermoids, they are known as cysts. So dermoid cysts, sebaceous cysts, these also can recur if you don't remove them completely. If you leave anything behind, these are known to recur. So you need to do a thorough job of removing them whenever you do remove them. But all of them are benign. They are not cancer except the desmoid tumor. Except the desmoid tumor, all of them are benign tumors, and they generally, once you remove them, that is the end of it.
Okay. So normally I've seen in general people who are in their mid-age, I see some small little lumps
Yes,
over.
those are
these?
same thing. Those may be sebaceous cysts, or because they are on the forehead, they are dermoid cysts. And the dermoid cysts can occur here also in the midline, above the nose. You see some people have above the nose. So these are lines of fusion.
Correct.
So those can be dermoid cysts.
So they grow slowly or they come in suddenly?
Generally slowly.
Okay.
Because the etiology, the cause is from the birth. So that is known as an implantation cyst, the dermoid cyst. The sebaceous cyst is known as retention cyst. The lipoma is a tumor. Hemangioma is a hamartoma, but it is a kind of tumor. The desmoid tumor is also a kind of hamartoma, but it is local recurrence and it is also a tumor. The first two are cysts, the others are tumors.
Okay. Alright. Wow. I mean, this is very common, but you don't
Yes.
know whether it is
Yes.
something which
So
is...
basically you have to be careful, you can't take it lightly, because I have seen people thinking that hemangioma, and I mean it's a dermoid cyst, and opened it and then they found that it is bleeding torrential, and then they don't know what to do. And especially if you have not kept the cautery, you need bipolar cautery. There are two types of cautery, unipolar and bipolar. The bipolar cautery is like a forceps. If you hold it like this, the vessel will seal. So with the bipolar, you can go and, coagulating all those feeding vessels and then remove the hemangioma. With a unipolar cautery, you may or may not, it may not be that good to do that particular operation. But for other, this is not that required, because they have generally one feeding vessel which you can tie it. When it comes from below, you can put an artery, tie it and remove the cyst. So it doesn't affect much.
Okay, alright. So that was all about the lumps and bumps on the body which come at certain parts of the body.
Yes.
And it's better to get it treated or...
Yeah, the reason is, I just wanted to complete,
sure.
the reason is that A, they will increase in size.
Correct.
And they can compress, so compression. Second is, many times they get infected, not lipoma, but dermoid and sebaceous cysts can get infected. When they get infected, they start giving pain and they become suddenly increase in size. Okay? And if it is increasing in size and you are thinking that whether it is something else, it is not benign and it is something else. So if it is increasing in size, or it is causing a pressure symptom, or it is infected and causing pain. These are the three reasons to generally remove. And fourth is cosmetic.
Got it. Cool. Alright, you heard Dr. Nikhil. So stay tuned for further episodes. If you like this particular one or you have any queries, let us know in the comment section, and stay tuned for the next episode where we talk about the
Lumps in the neck.
lumps in the neck.
And goiter, which is lump in the midline of the neck, which is the thyroid swelling.
Alright.
So there will be two separate episodes.
Sure. Alright then. So please subscribe to our channel, like our video, share with your friends and family, and stay tuned.